act before death becomes inevitable. We do not wait for collapse. We do not wait for mass graves. We intervene when the warning signs are clear. And today, those warning signs are undeniable. Bombed hospitals, starving children, detained and tortured doctors, entire populations pushed to the brink. Let us be clear. Genocide is not a strategy. Sorry, genocide is not a tragedy. Genocide is a decision. It is a decision made by politicians.
What are even decisions?
And complicity in this genocide or any genocide is a choice. That is why we are here with one demand. Our tax dollars must be used to save lives, not to end them.
Yeah.
April is the International Genocide Awareness and Prevention Month. After World War II, the world said, never again. But that promise was left in the hands of politicians, war profiteers, and the ruling class. And we are living the consequences. So today we say no more. No more. We will not leave humanity at the mercy of war makers, billionaires, and systems built on exploitation and debt. Today, we all take an oath, not just as doctors, but as human beings, to defend life wherever it is threatened. From Gaza, Palestine, to Lebanon, to Iran, from Sudan to Congo, from Tigray to Rohingya, from Cuba to Washington, from Detroit to Los Angeles, and to DC. All the people are ours. All the children are ours. All the lives are ours to save. And we accept this duty. Say it again. We accept this duty. We accept that responsibility.
We accept this responsibility.
And we will never back down. To every colleague who showed up today, thank you. You are on the right side of history. Thank you. You are on the right side of history. And to those still watching, still hesitating, this is your oath. This is your responsibility. This is your moment. Join us. Join us. And now it's my honor and our honor to introduce Congresswoman Rashida Tlaib. Who is, I'm proud to say, he is my representative. I've never seen anything his work for any politician.
Yes, he's the only one that can text me at 12:33 a.m. last night. But thank you so much to the incredible doctors that are here that understand the oath they took doesn't end at any border. And so thank you so much. As you all know, it's April, and April is not only a celebration, of course, of spring, but it's also understanding that Genocide Awareness Month is this month. And that genocide, again, anywhere must be called out. But this month is much more than just a moment of reflection and understanding and awareness. It must be met with unwavering commitment and action and ending all forms of violence and oppression against all people. I love that when you see Doctors Against Genocide, what does that say? It says, not another child, not another hospital.
Yep.
This is incredible. You see it in anything that, again, they stand for. I don't care if it's in the Senate side or in the House side, when they do actions all across the Capitol Hill and making sure they understand, again, the importance of calling out and saving lives, again, no matter faith or ethnicity. We're experiencing a genocide and mass atrocities as we speak right now in Gaza and Lebanon, Sudan and Congo. Whole generation of families and communities are being wiped out with our own tax dollars and weapons. Shame. You know, today is tax day, and I've talked to so many people that say when they fill it out, they're always wondering, God, is this going to be used to kill another child? We already know our government is committing war crimes in Iran, massacring young schoolgirls, and then lying about it. The president is threatening genocide against the Iranian civilization. Donald Trump already asked for $200 billion more for his unlawful war on Iran. This is an addition to the 1.5 trillion that he wants for the Department of War this year. A department that hasn't literally has not passed 8 audits in a row. Think about that. It's ridiculous and shameful and inhumane that our tax dollars, again, are being used to fund genocide and war crimes. Last year, Republicans cut $1 trillion of healthcare, and you all know this. Millions of our neighbors were kicked off of the Affordable Care Act, and we can, have a conversation about our healthcare system. But cutting people off of access to healthcare, that is literally a death sentence for so many of our families. But they have no problem, not once, to spend money on endless wars. They come up with money, bombs, destruction, death funding like this. I watch them while I beg them for money for clean water. While I go through the schools in my district, they have garbage bags over fountains. Our little babies are passing by because the water is so contaminated. But they can't seem to find money for that. We all know that we should be spending money to be able to have health care for every single neighbor across our country, to make sure that our children have access, again, to clean water, to making sure that our unhoused neighbors are able to get access to housing, to give every member of our communities opportunity to thrive, not just survive. But also, shame on them in trying to take our right to speak up and the right to dissent. The right to dissent is an American value. That's how we protect our democracy. So, in the sea of white coats, thank you for exercising your right to dissent and saying we don't want $1 being spent on genocide. You know, our government continues to send these blank checks for war crimes and ethnic cleansing. Children across the country are being murdered by bombs and bullets that are made here in the United States. You know, I am so ashamed when sometimes you see the videos and they pull up the debris and you see made in the USA. It just kills me inside. Again, we're supposed to be the land of the free. We're supposed to be standing up. We signed on to the Genocide Convention. Yet here we are treating a whole population as if they're disposable, as if they're but we must hold individual perpetrators accountable and complicit corporations accountable. Even as we end this genocide, inshallah, one day, we must hold them accountable. They are war criminals, and again, they must be held again to justice, and again to be able to see again them being held accountable from the public. We must stop sending any weapons at all right now to the genocidal government of Israel. You all know and you see the indiscriminate bombing all throughout Lebanon. It's shameful when I have to sit and embrace a mother in my community who says her whole village is gone. Literally, it's memories. It's incredibly painful. But what I hear from her is how incredibly dehumanizing it is that she lives here and she feels completely invisible to her own government. That somehow her pain and her suffering doesn't matter. So we must push back against and reject those that continue to try to police our words and try to tell us that we can't even call it a genocide. Shame on them. And shame on them for sitting there trying to gaslight people, mislead folks that we're standing up for anything but saving lives. When I tell people, talk to a doctor that came back. They have done missionary work. Many people behind me have done missionary work all over the world. And they said they have never seen anything like it. When a man, literally from California, a doctor, went to Gaza, he said, I've done missionary. This is maybe my 6th time. He said, I help fire victims. I help make sure they can have a life that they can thrive and they can be able to, again, get the access to healthcare and be able, again, to get the services they need. He said, Rashida, I was never trained to treat a child that has been exposed to white phosphorus. To watch a child, he said it was 8 years old, watching their skin literally being burned alive, just the oxygen in itself, burning its flesh of a child. So when they sit there and try to gaslight us and say, stop it, you don't need to do this, calling it collateral damage, shame. To try to say it's not a war crime, shame. To think right now that many of my colleagues are silent right now about what's happening in Lebanon. They're literally not saying one word about what is happening. Yet it is us, the primary funder and investor in this genocide and ethnic cleansing campaign. I want American people to know, these doctors behind me, I don't speak for every single one, but I know this. They want to invest in life. They want to stop funding death and destruction, and they want to fund programs that help people live a beautiful, thriving life. And so shame on you for attacking them, for holding their oath of the work that they have to do as a doctor, and then making sure that there is no borders or line where it stops. So thank you all so much for your incredible courage. You give credibility, literally, for people like myself and others who are fighting and advocating and holding these members accountable in the House of Representatives as well as the Senate. You come with the real data and information. A child is a child. A hospital is a hospital. A school is a school. Discriminate bombing is indiscriminate bombing. Using white phosphorus literally on a civilian population is a war crime. And so as you all continue to do that and show up in this way, know that it is working. More and more people are starting to see, again, the human impact, the human suffering that is happening, even as members of Congress try to erase it. Thank you from the bottom of my heart. You all know I come from a beautiful district that always has my back. But when they see this inspires them to continue to try to work in their own communities in Michigan. This inspires them to know that they're not alone. So thank you to Doctors Against Genocide for always doing the right thing.
Thank you, thank you, thank you, thank you. One more time, I'll see the police. Thank you. The people who leave you, you're all behind you. Huh?
I want to hear a selfie. I get a selfie if you call me that.
Don't talk to your wife.
I'm sorry, I know we're live. Okay. All right, everybody say Doctors Against.
Wait, I'm joining.
Okay, 1, 2, 3. Doctors Against. Oh my God, it's a timer. Thank you so much.
Thank you. Well, for the second time, we're gonna go with our speakers. It is our honor to have them. We're not gonna listen to just regular people. On behalf of Doctors Against Genocide, we are really thankful and appreciative to all of them. These are voices of people who are not just speaking the truth, but living it. Voices from the front line, from the affected communities, and from those working every day to defend life against impossible odds. So please welcome the list of our speakers. I'll have each one of them introduce themselves first, then give their speech. We're going to try to be organized. It's only 2 minutes each speech, so we cover all the topics and we give everyone the opportunity to speak. Thank you. Please shout out to our speakers.
Good morning, everyone. Thank you, Representative Taleb, for speaking truth to power. So my name is Salman Khan. I'm an infectious disease doctor from New York City. I recently returned from a medical mission for 3 weeks. I was in Gaza, just got back last month. And I'm here today to share some of the truths that I witnessed while I was there. So despite a so-called ceasefire, the situation on the ground is dire. People continue to be denied access to the most basic human necessities: clean water, nutritious food, adequate shelter and sanitation, as well as the right to health care. Every day, patients in Gaza die from preventable and treatable causes. Infectious diseases such as pneumonia disproportionately affect children and the elderly and can be prevented if enough vaccines are allowed in and if people's hygiene and living situation can be improved to a level compatible with human dignity. There's also a critical shortage of effective antibiotics in Gaza, exacerbating an already urgent antibiotic resistance crisis. Antibiotic-resistant bacteria do not respect borders and can spread rapidly around the world. So this is a public health issue that impacts all of us. Infectious diseases also spread like wildfire in Gaza's hospitals, causing outbreaks due to ongoing restrictions imposed by the Israeli occupation on entry of medical supplies that we take for granted, like cleaning solution or personal protective equipment. Patients with cancer or patients requiring specialty surgery are often denied the right to medical evacuation to seek treatment for their conditions, leaving them to die a slow and agonizing death. Doctors and other healthcare workers are often denied entry into Gaza to provide life-saving care. As American taxpayers, the man-made disaster in Gaza should shock our collective moral conscience. We need to immediately lift the siege on Gaza. Restrictions on everyday aid and supplies must be lifted. What is allowed to enter now is only a fraction of what is needed. Humanitarian workers must be allowed to do their job, and funding to UNRWA must be restored fully. And Israel must be held accountable for its genocidal acts in Gaza, which it is actively repeating in Lebanon right now. At a minimum, accountability starts with blocking the sale of bombs and bulldozers to Israel. The Senate behind me is set to vote today on a joint resolution of disapproval on this critical issue. Senators, I implore you to vote yes. You are accountable to us, the American people, not the state of Israel. And the American people overwhelmingly want our tax dollars to be used for good, not for endless wars and violations of human rights. Thank you for your time.
You got the same on. Thank you. You can say it. Dr. Moore.
Hello. My name is Noor Sharf. I'm an emergency medicine physician. I'm from Dallas, Texas. Over the past 10 months, I have traveled to Gaza twice. Today, I stand alongside hundreds of my fellow healthcare workers in solidarity with those who are suffering all around us. We are not gathered here today in pride or celebration. We are here holding a deep sorrow as we try to reason with the fact that we live in a country that values gas prices more than human life. A country that has generously donated billions of dollars to Israel for weapons of mass destruction, while its own healthcare system continues to crumble under a financial crisis. Many of us standing here today have witnessed genocide firsthand. All of us are firmly against it. I want to be clear when I say what I saw in Gaza is without a doubt the worst genocide we have seen in our lifetime. I also want to reiterate that any healthcare worker incapable of understanding why we advocate for human life does not deserve a place in medicine. The man-made crisis I witnessed in Gaza fundamentally changed me. I don't think I will ever make sense of why my country has decided to pursue this bloodshed. In July, during the midst of the genocide and the famine in Gaza, I was working at Shifa Hospital in northern Gaza. And every single day, we received a mass casualty. Hundreds of patients came into the emergency department after mass shootings or intense bombings with weapons of mass destruction. The worst part of it all is that these innocent civilians came from so-called aid distribution sites. The Gaza Humanitarian Foundation, otherwise known as the GHF, is a fake organization created by Israel and funded by the United States of America that used to deliberately lure civilians who were famished, deprived of food after Israel created a blockade around all of Gaza that prevented the entry of clean drinking water and any food. After arriving to these sites, desperate for sustenance, believing that they would receive aid, people were killed. Those who survived sustained injuries that were too gruesome to describe, from completely amputated limbs to organs hanging outside of the body. Not even the youngest children were spared. My youngest patient, Isla, was only 2 years old when she died in my arms after a bombing that killed her. I can't tell you how many children I saw like Isla in Gaza. children that arrived as body parts collected by their parents from underneath the rubble, children that were orphaned after the weapons destroyed their homes and killed their families. I don't need to convince you that that is not okay. I visited Gaza again in January of this year, and I worked at Nasser Hospital in southern Gaza. I was expecting that given the terms of the genocide, I wouldn't see traumatic injuries by Israeli gunfire, but the reality was far from that. The deliberate targeting of civilians continued. My 19-year-old patient, Shahid, was shot in the head by something called a quadcopter, an AI-powered drone that is ammunition-filled that shoots without any human intervention. He died shortly after arrival to the hospital. I will never forget holding his brain matter in my hands. And still today, not a single day goes by where someone isn't murdered in Gaza by Israel. Make no mistake, we are complicit. We are funding this war. The question is, when will we stop making human dignity political? Thank you.
Hello, Assalamu alaikum. My name is Suad Abdelaziz. I am a Sudanese American lawyer and the executive director of Decolonize Sudan. Today marks 3 years of genocide in Sudan. On April 15, 2023, the terrorist RSF militia took siege of Sudan and began what was to follow 3 years of terror, of displacement, of genocide. In the first hours of this siege, all major hospitals within the capital were bombed, occupied, and shut down. Civilians were trapped by urban warfare and subsequently massacred in the days to follow. In a matter of months following, the entirety of Sudan's healthcare system collapsed due to RSF destruction and annihilation. The RSF militia, called the Rapid Support Forces, is a proxy militia of the United Arab Emirates. At the heart of the genocide in Sudan is the U.S. war machine. The U.S. is the main weapons manufacturer for the United Arab Emirates, and weapons supplies have only increased since this genocide began in 2023. This is despite U.S. intelligence confirming the United Arab Emirates' role in arming, funding, and providing fighters to this genocidal militia. I like Dr. Nidal's phrase of genocide is not a tragedy. It is a strategy. It is a decision, and it is a profitable one. It is about control of land, extraction of resources. And that's precisely what's happening in Sudan. Our Congress people, I want to note that over the past 3 years alone, the U.S. has approved at least $10 billion in weapons to the UAE, with now over $7 billion approved for this year alone. So today is tax day, and our taxes are funding the bombs killing children, the arms killing children from Sudan to Palestine, from Lebanon to Iran. The blood is in our hands. And so Sudanese people call for a UAE arms embargo now. Our Congress people have introduced bills, House Bill 2059 and Senate Bill 935, the Stand Up for Sudan Act, which would cut arms to the United Arab Emirates until it stops its support of this genocidal militia, the RSF. So we must demand that our Congress people stand up and with integrity, stand up for and support House Bill 2059 and Senate Bill 935. A UAE arms embargo is the only answer for true peace in Sudan. If we want peace, we must stop the arms coming out of this country.
Hello, everyone. My name is Jamie Brown, and I am a registered nurse from Michigan.
and president of National Nurses United. The Nurses Union. Thank you to Doctors Against Genocide for organizing this event. It's great to be with all of you at the Capitol today to stand in solidarity together to say we must end genocide.
Yes.
Just yesterday, we had 200 nurses here calling for an end to Trump's fascist agenda. And now we have so many white coats out here today. Ask any nurse, and they'll tell you from the Capitol to the C-suite, nothing scares suits more than when doctors and nurses organize together. Here's the reality for nurses. Every day we hear from patients, coworkers, and neighbors about how scared they are right now. Patients are intimidated to seek care, whether it's because of racist immigration enforcement or concerns about encroaching technology. Despite this, our hospitals are still understaffed and our healthcare workers are overburdened. Our emergency rooms are at capacity and people are losing access to care because of Trump's cuts to healthcare funding, taking money from our hospitals and giving it to secret police and defense contractors, building the tech and bombs used to invade cities like Minneapolis and attack places like Gaza. Meanwhile, prices for everyday necessities like groceries, gas, housing, and utilities are also going up. And while our families are struggling, our country is waging war and empowering the destruction of struggling families and entire communities across the world. Congress and the Trump administration are using our tax dollars for destruction, harm, and genocide. Whether
but it's hard to translate that into things outside of our regular sphere of influence. And so one of the things that we're here to do today, we're here to name it. It's a genocide. It's happening in 4 different places across the globe: Rohingya, Sudan, Xinjiang, East or Western China, and many that are just on the brink. But even then, the nomenclature, how we describe it, crimes against humanity, collective punishment, genocide. When you are standing in genocide, when you are saturated, when there's a taste of metal and blood in your mouth, those terms seem euphemistic. I experienced a moment in Gaza when a young teenager came in with shrapnel in his head. Death was imminent. And it was a relatively quiet moment. And I told the father, I said, "I'm so sorry. I bought this bomb that's going to kill your child." And he swung around immediately, crying. And he held me so close and he said, "No, Mark, no, you did not." And I staggered away, shaking, tears in my eyes. And I thought to myself, yes, I literally did. I did, in fact, pay for this bomb that's killing your child. So, as physicians and nurses, we're imbued with this idea of first do no harm. I mean, it should saturate us. It should be visceral. And this is a call to action. We identify harm, we name it, and then we do something. We don't expect everybody to be a full-time activist. But there are so many things we can be doing. We can be publicly writing. Finish that letter to the editor, that op-ed piece. Contact your congressperson. Talk to your sphere of influence, your family, your friends, your colleagues, your neighbor. Tell them what you've seen. Be a witness. Push. And then right now, today, this is such a beautiful form of solidarity. Nurses, physicians, allied health practitioners, all together here saying no and demanding a stop to genocide. We're going to go up the hill. We're going to meet our legislators, and we're going to ask for very specific demands. Stop providing bombs for systematic annihilation of populations.
Yes.
Restore and protect humanitarian aid.
Yes.
And if it's at all possible, go to these regions. It's complicated, it's dangerous, it is frightening. But if you're able to go, put your feet on the ground, scrubs on the ground, and take action to show people love, show that you care, show that this is important, that the entire world does not believe and behave like the military industrial complex, that we are human beings. People understand the difference between governments and people. We are the people. Let's do something about it. Thank you. Yeah.
That's that Cadillac. That's the Cadillac of Dr. Genocide.
I'm Claire Cohen, a child psychiatrist and physician from Pittsburgh, Pennsylvania. I'm also a member of National Single Payer of Black Lions for Peace and American Friends Service Committee. In his April 1967 Beyond Vietnam speech, Martin Luther King said, "The United States is the greatest purveyor of war in the world today." He also said, when machines and computers, profit motives, and property rights are considered more important than people, the giant triplets of racism, materialism, and militarism are incapable of being conquered. A nation that continues year after year to spend more money on military military than on programs of social uplift is approaching spiritual death. Today, almost 60 years later, these words still ring true. Our government commits and facilitates genocidal violence in almost a dozen countries, including Gaza, Lebanon, Iran, Sudan, the Congo, and Haiti. The U.S. also perpetuates sanctions against 1/3 of the countries in the global south, including Cuba, where the current total siege is approaching genocide in its impact.
Yep.
Meanwhile, here at home, instead of taking care of its people, our government is committing violence against Black, brown, and Indigenous people, as well as other marginalized groups through sometimes daily, always cruel ICE and police raids and imprisonment. It also promotes the exorbitant enrichment and profiteering of a small group of billionaires and multimillionaires over the needs of the masses, especially in healthcare, where our profit-driven system deprives millions of access to needed healthcare, sends millions into medical debt, and causes an estimated 68,000 deaths a year as a result of a lack of access to adequate medical care. We ask you to join DAG and the other organizations here today in fighting for our country to be a nation that promotes justice, health, and well-being at home and abroad, like Cuba does, instead of oppression, militarism, and genocide. End genocide and occupation. Stop unilateral sanctions.
Yes.
Medicare for all.
You need to hold that so that the shadow.
Oh, no, yeah, just on the stuff. My name is Dr. Halashami, and I'm an ear, nose, and throat physician from Florida. And I traveled to Gaza in January of this year and was based in Khan Yunis at Nasser Medical Complex. What I witnessed there is difficult to fully convey, but I will try. Across the region, there is vast destruction of infrastructure. The healthcare system has been nearly decimated. Hospitals, clinics, and dialysis centers that were once places of sustaining life are damaged, destroyed, and barely functioning. At Nasser Hospital in Khan Yunis, staff continue working with extraordinary resilience despite everything that they have endured. The doctors persist. They are performing surgeries without sterile drapes. They're improvising by using 2 surgical gowns to create makeshift barriers. Instrument trays are incomplete, missing essential tools required for life-saving procedures. There isn't a single functioning MRI machine in all of Gaza, not one. And after medical procedures that often require postoperative monitoring, patients are discharged to make room for more patients in need of life-saving care. But they're not discharged to safe, clean environments. They're discharged to flimsy tents in the sand with no sanitation, no clean drinking water, no means of safety or protection. This creates dangerous conditions where infection is not just a risk, it's an expectation. As visiting physicians, we faced our own constraints. We were strictly forbidden by Israel from bringing in any medical supplies. We arrived ready to help, but without tools that it could have made a critical difference. Today, we cannot remain silent. We are calling on the United States government to act, to insist that borders be opened so that adequate medical aid, supplies, and temporary housing can reach the people of Gaza. This isn't about politics. It's about humanity, dignity, and the fundamental right to care. What I saw demands not only acknowledgement, but urgent action.
Hello, I'm Jill with the Sanctions Kill campaign. We are very pleased to join Doctors Against Genocide on the Hill today on Tax Day to say no more taxes for genocide. And I want to echo what our comrade Claire here said today about the sanctions killing so many people around the world and remind you that the genocide in Gaza was happening for 16 years due to the blockade of Gaza before October of 2023. And as Claire pointed out, one of the countries that has the best health outcomes in the world because they prioritize human needs, Cuba, has seen more than a doubling of infant mortality in the past few years because of the escalation of the U.S. illegal unilateral coercive measures imposed on the island nation, especially with the oil blockade of the past few months. I want to invite all of you to please tell your members of Congress to pay attention. The tide is turning. People are understanding this, and they have an opportunity to learn about this more with a congressional briefing 1 week from today, April 22nd, Cannon House Office Building 130, 2:30 p.m. Congresswoman Delia Ramirez is hosting a briefing with experts about the humanitarian impacts of economic sanctions, particularly the over 250,000 children who die from these illegal measures every year. And we're using Cuba as a case study. Thank you very much.
Hi, I'm Annette Blake, and I'm a leader with the United Workers in Maryland. We are a poor people's human rights organization. We are connected nationally with the Nonviolent Medicaid Army. Building a movement to end poverty, led by the poor and fighting for our human right to health. We stand here today with Doctors Against Genocide to speak out against the war on the poor and dispossessed at home and abroad. I became homeless trying to take care of my mother, who was suffering with 3 types of cancer. I was unable to work due to my mother's illness. My mother's medical bills were outrageous because her pension was $1 over the threshold. She couldn't get Medicaid. Her feeding bags cost $900 a day. No one should have to go through what my mother and my family went through, watching your mom die because you cannot afford to pay for the feeding bag that she needs. Losing your housing in order to keep your mother alive. Unfortunately, I'm not alone. In the richest country in the world, an average of 800 people die a day due to poverty. Nearly a third of people experiencing homelessness attributed to medical debt. And we know that homelessness and housing instability leads to greater health issues and even death. For decades, social welfare programs have been continually cut, saying there's not enough money. Meanwhile, the military budget continues to grow. There's nothing new about this war on the poor, but it has become genocide. Last year, Congress passed a big, beautiful bill for billionaires, cutting nearly $1 trillion to Medicaid and over $120 billion to SNAP over 10 years. At the same time, they enlarged the Pentagon budget to more than $1 trillion. Billions of dollars going to bomb homes, hospitals, schools, killing tens of thousands and displacing millions of other, mostly poor people in other parts of the world. When these funds could be used to meet the needs of humanity and promote our human rights to health. We got to transform this whole system that is killing us here and abroad. It's going to take organizing. It's going to take all of us, poor and working class people, coming together across issues, lines of division, national borders, to build the power needed to change the system. We are here today to speak out, to call on our elected officials, but also to build permanent connection, because this cannot be a moment. It must be a movement.
Thank you.
Hi, hello all. Thanks for being here today and all of the speakers that came before me, right? The facts that you have talked about, what more can I say? But I'm going to talk specifically about our culture of violence, the culture of this United States and its culture of violence, right? I'm a clinical assistant professor of family medicine at Brown University, and I also lead an organization called Community Health Innovations of Rhode Island. So my message is to our president, Mr. President, and the minions and architects that prop you up. There is nothing attractive, noble, or useful in the culture of violence you cultivate. You want to be a true healer? Then stop the violence, stop the genocide. History may not repeat itself, but it definitely rhymes. You don't want to listen to Pope Leo? Then listen to Pope John Paul II, who said, violence is a lie. Violence destroys what it claims to defend and destroys the fabric of society. Do not think that courage and strength are proved by killing and destruction. Mr. President, be the healer you envision yourself to be. Stop cultivating a culture of violence. Stop the genocide.
Show them your leg. Look your leg.
I sprained my leg. Good morning, everyone. My name is Dr. Catherine Esperanza. I'm doing my postdoctoral hours in psychology in Portland, Oregon. And on February 4th, 2026, ICE shot me with a tear gas canister gun, breaking my leg while I was non-violently protesting at the McAdam ICE Detention Center in Portland, Oregon. They broke my fibula. I had to get a surgery and a stabilizing plate put in. But what happened to me is not an isolated incident. It's an example of the imperial boomerang. The weapons that they use on us as activists, the AI and other technologies that they use to trace us, track us, and immigrants, those have been tested and used first on Palestinians. So if you are against ICE violence and police brutality, you have to be against genocide and occupation in Israel and everywhere. And what they did to me, you know, they're doing far worse in detention centers from the United States to Israel, like what they're doing to Dr. Advocacy. And so to really meaningfully be against ICE violence and police brutality, you have to also speak up about genocide and violence everywhere. And so I'll end with the chant that we say in Portland. From Portland to Palestine, occupation is a crime.
Assalamu alaikum, everyone. My name is Sadiq Al-Mahdi, Sadiq Al-Mahdi. I'm a physician. I'm a Sudanese American physician. And I think many aspects of that identity are important here. Number one, I'm an American. So as an American, I should stand up for people's rights at home and abroad. And as an American, I think we all have the right to express when we're in disbelief of everything going on around the world right now. As a physician, I swore a duty to first do no harm. And when we're supplying all these wars around the world, all we're doing is harm. Yes. As a Sudanese, I have watched my country of origin go through the largest genocide in the world for the past 3 years. Today marks the 3-year anniversary. In 2025, 80% of attacks on hospitals in the world happened in Sudan. In 2020,
Besides, I cannot find out if this medication is working for my patient or not. This is a medical genocide. This is a sick people genocide. We don't just have genocide is not by killing people through weapons. When you take away healthcare, when you have the embargo on them, like in Cuba. Cuba used to have infant mortality that's better than the United States. Now it's worse because we're not giving them resources. We're punishing the people because we don't like their leadership. This is insane. This is something that in 100 years, people are going to look at us and say, what were you doing? How come you didn't do anything about it? This really makes me angry. This is why I'm here. On April 15th, I decided, yes, I'm going to pay taxes. I have to. I have no choice. But I want to make a point. I want to go to these guys that are making policies and tell them this is ridiculous. Our tax money should not go to kill people, to have sanctions on people and lead to their death of children. We should have some humanity. If not, then stop talking about the morality of our country. We have no morality. We have no heroes. I'm sick of all this heroism of like Marvel and DC and all these actors that like they stay silent and do nothing about it. This is very true. We need to do something. We have to be vocal. I mean, we're trying to be peaceful, but people can only stay quiet for a while. I do at least 2 or 3 calls a week with the insurance company trying to convince them to pay for life-saving drugs because they're not covered or they don't, meet the criteria or it's not familiar.
All the bombs are covered.
The bombs are covered. It's so easy to go bomb Iran, spend 50 billion in 3 days. But like that, how much care that can cover and in the healthcare. I really thank everybody who came here. I am proud to be with all of you. I'm proud to be on the right side of history. I'm proud to be Nidal's friend. So thank you all and free Palestine. Free. And today we're going to learn from the school. We're all out here. We're all one. We learn from each other. Okay.
Hello, my name is Bryn and I'm a rising third-year medical student. I have been a member of Doctors Against Genocide for the past 2 years, advocating for the recognition of genocide as a public health crisis and doing everything in our power to put an end to it. Over these past few years, I have had the utmost privilege to connect virtually with medical students and doctors in Palestine. Through monthly grand round meetings, we discuss various cases that our colleagues on the ground see in their hospitals and clinics. We hear harrowing stories and experiences they have on a daily basis, things we healthcare workers here in the US could never imagine unless we had been to Gaza ourselves to see it firsthand. In Gaza, my fellow medical students have had to study in dark, decrepit tents on the beach in the freezing cold of winter. Doctors have had to work tirelessly on never-ending shifts in hospitals that have been targeted illegally by US-funded bombs, leaving them with little to no resources, including medications as simple as acetaminophen, supplies like gauze and dressings for wounds, baby formula for newborns. Families are literally being torn to shreds in the streets of Gaza, of Lebanon, of Iran, despite ceasefire agreements that are anything but an end to the indiscriminate murder of innocent people. This isn't just an attack on faraway places. Your neighbors are being targeted too. People are being detained in the most obscene and inhumane conditions, or even being killed at the hands of people wearing ice across their chest as if for a badge of honor, when it is truly nothing more than a symbol of hatred and violence. What happened to those America First promises you voted for? What happened to your healthcare, your education, your children's education, your ability to pay for a carton of eggs or a tank of gas without wondering if you will break the bank? I'll tell you what happened. The legislators you voted for decided not to care about you. They decided to funnel your tax dollars into the ceaseless cycle of war, genocide, and ultimately the military-industrial complex that makes them filthy rich and leaves innocent people here and abroad pulverized to dust. Shame. A quote that has been lingering with me in moments of despair comes from an interview with James Baldwin. He spoke on the injustices he faced at the hands of U.S. policymakers in the 1960s. He said, "You can put me in jail, you can kill me, you have done everything you can do to me. The problem now is, how are you going to save yourselves?" On this tax day, I want you to realize that your hard-earned money is lining the pockets of warmongering, genocidal authoritarians with no regard for the sanctity of human life on US soil and abroad.
Yes.
People are dying by your tax dollars. Innocent healthcare workers, men, women, and children are dismembered and killed by bombs bought with your money. Today, I am here. All of us are here to call for an end to war, an end to ICE violence, an end to genocide funded by us. My question to you is, what are you going to do about it?
I'm bring it in. How long?
Hello, everybody. Thank you all so much for being here today. I am a pediatrician, like our president colleague, Dr. Samuel Sophia. And I've had the eternal privilege of getting to serve in Gaza twice, most recently in January of this year. I've dedicated my life to protecting children, and that responsibility does not end at the bedside. It does not end when I leave the hospital. To care for children means not only treating their wounds, but doing what we're doing here today and speaking out to prevent those wounds from ever being inflicted. This country is in need of a moral awakening.
Yes.
At a time when our schools struggle to provide even the most basic resources, our government chooses instead to invest in systems that cage children at home and fund their deaths abroad. Shame. I stand here today with my fellow physicians and healthcare workers from Doctors Against Genocide, calling for the protection of children and all civilians here in the United States and everywhere, because the value of a child's life does not change based on the side of the border they are born on. Children's lives are sacrosanct. And the world we find ourselves in today is a world that has forgotten this. It is not by accident. It is the result of every adult who has remained silent and every leader who has chosen inaction over courage. But it does not have to remain this way. We have a responsibility, not just as professionals, but as human beings, to refuse to accept a world where children are treated as expendable, to demand better, to speak louder, and to act.
Yes.
Yes.
I leave you all with words I think about often, words of James Baldwin, who says, "The children of the world are ours, every one of them." And anyone incapable of recognizing this is incapable of morality.
Yes.
Thank you.
Thank you. Thank you, everyone. We're sitting really hot here.
Yeah.
And the more hot it got, I insisted on continuing even more because I want to feel how it is there in Sudan now. How is it in Gaza now? Where they have no shelter, they have no water, they have no hospitals, they have no umbrellas. So thank you for being with us. Thank you for joining us. Let's make these powers of hold hear your voice. We need to go strong. We need to go firm, but we have to be organized, professional, and respectful. Please go with your team. If there is if you see any defect of this organization, please be part of fixing it. We need to work together. We don't want them to dismiss us as a group of disorganized people or loud people coming here. We are coming here with a powerful message, and we need all the focus to stay on that message. We refuse to be part of the genocide. We refuse for our tax money to be spent on killing other people, children, rather than paying for our patients' medications here at home. I think we hear this message loud and clear today. Nice as here to give us the final instruction.
Before I give you instructions, healthcare, not warfare.
Healthcare.
Healthcare, not warfare. Okay, thank you so much for being here, for, standing in the sun and the elements. I really appreciate it. But I also appreciate everyone who signed up. I got so confused with so many assignments shifting. That's all part of the process, right? We improvise, we iterate, we learn how to fight genocide. We were not born, with that skill, sadly. But Just raise your hand if you don't know who your team leader is. Just one? Wow, amazing, amazing. So come see me. We'll take care of you. Everybody else, do you know who your team leader is?
Yes.
Yeah?
Yes.
Amazing. Woohoo! It's working. The team assignments are all on the app. The app is not perfect, but it's work in progress and it should help us get organized. I'm not taking any meetings, so come see me if you have any questions. I don't think we can take the banners in. That's like protest system in the mess.
Yeah.
Yes.
Team leaders.
Okay.
Can I ask
Yeah,
all the
Ben,
team members to come here, please?
Will.
Say their names.
Please come and join us.
I've been absent far too long for a meeting because I moved all the way across town. I live in like Trinidad now. I used to live on 18th in California, so I was literally a 10-minute walk from Phoenix Valley. But you just sent an email trying to organize what we're doing up here. But I'm not surprised to see you here. I feel like every time I end up in a protest, you're around.